These are patients. We're prescribing things. When we're injecting a neurotoxin, we're injecting a prescription medication. We're in the business of making people feel better, but it is medical and it is medicine. So that's why we need to be licensed. We need to go to licensed practitioners. We need to make sure we're furthering our education with, accredited conferences and that type of caliber that we all need to strive for.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, I've just been thinking, we've been talking food, and then, we need a little bit more conversation about skin, and what about aesthetics?
Well, my friend, today I feel pretty. I feel really, really pretty. And, aesthetics is a big deal. It's a lot of what we do in our practice every day. We obviously do a lot of medical dermatology, cutaneous surgery, but the ability to kind of wrap it up with the nice aesthetic touch on what we do, isn't it great? Isn't it an amazing part of what we do? But as you know, I'm not the expert, so I wanted us to maybe talk to someone who's really good at injecting stuff. What do you say?
I think that's exactly what we need. So with us today, we have Allie McAllister. She's a Dermatology Certified Nurse Practitioner, and she's specialized in anti-aging aesthetics, and she's the founder of the Atlanta Injectors. And she can tell us a little bit more about our clinic. But Allie, welcome to the podcast. We're super excited to talk to you.
Thank you guys for having me. I'm excited to be here.
Fantastic, Allie. And, we like to take every person who's successful and try to understand, just for the sake of our listeners, how did you get to where you are? Because you are a person of different interests and a lot of different successes. You run a meeting, have a successful practice, have a good social media presence. Can you tell us how you got to be interested in this kind of entrepreneurship aspect of dermatology?
For sure. So aesthetics is something I was interested in even back in nursing school, especially in nurse practitioner school. The entrepreneurship part came later. I think now we're a little more comfortable with people becoming more entrepreneurial in different roles. But when I was a nurse, it was, you should be a bedside nurse and then you should definitely go into family practice. And I had been used to bucking the system a little bit with that. I didn't do any of those things. I did ICU for a little bit, went right back into school. And then my first job as a nurse practitioner was for a plastic surgeon. So I think being an entrepreneur is sort of paving your own way. And I kind of fell into it a little bit.
Amazing. And now you do a lot of different procedures and now you're doing a lot of different education. So perhaps we should start there, because doing education in aesthetic is a little challenging. It's a very procedural, it's hands-on. There's also a thing about how to look at things. It's more of an art a lot of times. How did you approach to design that? What is your thinking about educational activity or educational goals in the aesthetic realm?
Well, I think it started with just us not having enough. I don't know if you guys, what you experienced in medical school, but in nursing school and nurse practitioner school, there's no talk about aesthetics. There's very little talk about dermatology, even from a medical standpoint. But 10 years ago, when I got out of school, I knew that it was coming, right? I was very into like these beauty magazines. And that's kind of where I first heard about Botox, dermal fillers. And then my training was on the job for the plastic surgeon that took a chance on me and hired me. Some of the big pharma companies would come in and do some quick trainings, and that was it. They hand you a syringe and they're like, go fill some nasolabial folds. So since then, things have luckily improved, right? And if I think back to my first time injecting, I wasn't scared enough. And it was because I had not been educated on facial anatomy, on what could happen, adverse events, let alone what to do if an adverse event happens. So really, this whole educational piece came from me wanting to make sure that people had the education that I was searching for. So luckily, there's people before me that started doing conferences and doing private trainings. And I met another injector at a private training We hit it off. She's based out of Dallas, Texas. We were literally sitting by a pool one day and said, you know what? We went to this conference and it was cool, but I think we can do it better. And I think that we can spread the word and take injectors who are hungry for education and want to be educated and want to be educated the right way. And that's how Cult Aesthetics, our injector conference, was born. And that's how I fell into the space of educating others.
You know, Allie, you said something that I think is really important, which is that as you learn more, you start to realize where things can actually potentially go wrong. And sometimes when you don't know enough, you think everything's hunky dory until you realize, hey, wait a minute, there's a bit of anatomy to the art. And I will say, you know, in medical school, I think the same with nursing school, you don't get much training in aesthetics or in, I would say, dermatology, maybe a week of it. But of course, those of us that went to residency, we got a lot of training in skin. In fact, we got 3 years of it. And then in that, it varies from residency to residency how much aesthetics you get. But I still think there's something to be said for refinement and, you know, actually doing the procedures. And I don't know about you, Hadar, but I can only name like 1 or 2 residencies that do a significant amount of training when it comes to aesthetics, where you really like refine and, you know, react and refine further beyond learning the basics.
Yeah. Yeah, and at least from my point of view, I really think that maybe it's not a top priority in the beginning when you're trying to understand the whole kind of skin biology, pathology, pharmacology. There's so many different things to get in order in your brain as you start your residency and then progress and become better and better as you go. And so the aesthetic skills maybe come a little later. Also an area of interest. You know, some people are more passionate about it. Some are less passionate about it, but definitely a huge demand. No question about it. And
oh my gosh, to be a good injector is not easy. So Allie, tell us a little bit about, you know, how have you shifted the educational experience for people that are coming in? What did you see as the gaps in education? Maybe just access was one of them, but maybe going back to Hadar's question, procedurally speaking, there's a hands-on component. So how do you address that aspect?
So you have to start with the foundation. And I think you nailed it. It's that there are things that are deemed more important. And as far as staying alive and correcting, you know, disease, 100% that's accurate. So we have to remember that aesthetics are elective. So they've just not gotten the same attention. So where do you start? You start with the foundation. You have to understand what is the aging process, right? It's not just volume loss, it's a combination of factors. So you have to understand the aging process. You have to then understand all the products that are on the market, how to use those to correct different parts of the aging process. And then you have to understand how to convey that to a patient so that they understand what they need, they are realistic with the outcomes. And then you have to understand what to do if something goes wrong. So that's kind of a simple little, you know, pathway of where we start. And it's walking your injector through that process, making sure they really get it. And then as an injector, it's how do you educate your patient on the aging process, realistic outcomes, how to search for a great provider. And then that really important component that nobody wants to talk about is educating on how to manage the complications. And if you haven't had a complication, what we always say in aesthetics is you haven't been doing this long enough, you're not seeing enough patients, or you're not telling the truth. So we're trying to destigmatize this thing of a vascular occlusion or a nodule, right? It doesn't make you a horrible injector. What makes you a bad injector is not knowing how to treat it or not recognizing it because you're too prideful.
Yeah, absolutely. I think in the world of medicine, at least, learning from your mistakes, learning as a group, as a specialty, as a department, whatever practice you are in, learning from your mistakes is bread and butter to medical practice.
Totally
and
agree with you,
recognizing a
Hadar.
mistake. I mean, you know, I think we have the whole mortality, morbidity rounds and other practices like that that are totally direct at that. And I think you're absolutely right, creating a mentality where, you know, perfection is great, but nobody's perfect. And I think our patients need to understand that as well. And I know a lot of the practitioners that are very successful that I talk to in the aesthetic realm, I think they make the same point is that, you know, they have to put safety first to explain to people, listen, this is fairly safe, but things happen. And when you come into an elective procedure, as you mentioned, the bar for error is a little higher because people don't expect that. They think, oh, it's just like getting a haircut, right? But it's not. And so I think you make an excellent point, and educating people who are about to pursue a career in aesthetics is really key for them to understand that. Kind of a little humility, a little understanding of the anatomy, as I mentioned, and everything really will make for a great practitioner.
Well, and you nailed it too, that we've kind of glamorized aesthetics. It's always been, the cushy, really glamorized part of dermatology, or, some people see it as a plastic surgery realm. I think they're very heavily involved. But I think if we can shift that more towards being a medical procedure, then it allows your patients to take it seriously. I don't call my patients clients. You'll hear people say clients. These are patients. We're prescribing things. When we're injecting a neurotoxin, we're injecting a prescription medication. So, of course it's fun. And if you follow me on Instagram, I have a lot of fun with it. It's bright, it's colorful. We're in the business of making people feel better, but it is medical and it is medicine. So that's why we need to be licensed. We need to go to licensed practitioners. We need to make sure we're furthering our education with, accredited conferences and that type of caliber that we all need to strive for.
That's an excellent point. And one of the things you do as an educator is actually lead the way, right? You kind of set your goal onto the next challenge and to the next innovation. And I did notice that your group has a strong interest in ultrasound. I wanted to ask you about this because I do think that using ultrasound in dermatology, especially, is going to be one of the next frontiers. There's many different things that we are going to innovate and expand to, but it definitely advanced imaging at the tips of your finger could be really a game changer. Can you talk a bit about using ultrasound as you inject or in any other capacity in your practice?
Well, Hadar, before you get into that, Ali, could I throw a question right in between? Because I think this
Of
is an
course.
excellent segue. I love innovation. I was an engineer before going into medicine, so I want to hear about this. Can you talk a little bit about how aesthetics has changed over the last 10 years? And I'm sure like ultrasound wasn't used as often back then, and now it's being used more. So I'd love for you to then kind of bridge that answer into how you're using
Yeah.
ultrasound.
So, what I have to reference is when I first started, which was about 10 years ago, and we injected everybody's Botox the exact same pattern. We had a few dermal fillers, and we did cheeks, and we did lips, and we did nasolabial folds on everybody. So everybody kind of looked like an alien, and sometimes they had really arched eyebrows. So they had smooth foreheads and arched eyebrows, aliens walking around, and it kind of gave aesthetics this bad rap. And I think the biggest shift is looking at a patient holistically, seeing their features, what makes them look balanced and youthful, instead of us just kind of, I call it in my practice, Mr. Potato Head. I'm like, you don't come in here and just order a pair of cheeks or a pair of lips. Like, we're going to look at your anatomy. I don't just stick them on you, right? We're going to make sure everything flows and looks good. The last thing I want is someone to look at you and say, I know what you had done. I want them to say, what are you doing that you're not aging? So that's the biggest change that I'm seeing is we know the industry's booming. We know that it's growing, compounding year over year. We've got all these new devices. If you've ever been to Europe to an aesthetic conference, they have so many dermal fillers and neurotoxins that will eventually trickle their way to the US market. We're already seeing it with Daxxify hitting the market last year. Galderma's got a new neurotoxin coming out. Allergan's got a few new fillers they came out with. So we're seeing everything grow. And with that comes new innovations like ultrasound. So probably 4 years ago, I had an injector, a trainer, Dr. Weiner out of Florida. He came into our practice to do just a simple dermal filler training, and he brought this suitcase ultrasound. And it makes me laugh now because we've got all these sleek, really sexy ultrasound devices, but it reminds me of my parents' cell phone that they kept in the middle of the minivan, in a suitcase.
Right.
And I was like, Dr. Weiner, no one's going to use this, no one's going to lug their suitcase ultrasound around. And he was showing us all ultrasound, and none of us cared. We're like, we don't care to see the gray TV screen. And now here we all are spending a lot of money trying to get proficient in it. So there's always someone that really paves the way, and then a few of us that scamper behind them. So now what we're doing with ultrasound is we are using it to assess variations of anatomy. Before I'm injecting your piriform, I want to check that space to see, is your facial artery superficial, or are you, of the smaller percentage that has their facial artery right on bone where I would like to place that filler. I'm looking at your temple to see your anatomy in the temple before I inject there. These higher risk areas, it's unrealistic that we have time in a busy clinic to scan everybody's face. And there are limitations to it still. People think that we can instantly solve an occlusion with ultrasound, and it does help a lot, but it's not a miracle. It's just another tool in our toolbox. So I think you'll hear some pushback on it, and that's because it's something new and it's challenging. I think, Dr. Dar, you said you're using ultrasound in your practice. It takes some practice. It's not something you do a couple times and you feel like you're a pro at. At first, it does look like just gray static. But slowly and surely, you're seeing it brought into practices. I'm using it to identify migrated filler oftentimes, seeing in what tissue plane is it, if we need to dissolve it. A lot of bad under eye filler out there, and I love to look at it with an ultrasound. And sometimes it takes some convincing for patients because this filler was placed years and years ago, and they've been told over and over that filler dissolves after 8 to 12 months. So they're like, there's no way it's filler. It's just puffy under eyes. I can clearly see the Tyndall effect. I know it's still filler, but when you show them on ultrasound, they believe you. So that's how it's being used in my practice currently, and it has taken a lot of training. We are offering it at almost every one of my conferences, and then I personally have done a conference that was just ultrasound. I just recently flew out to Seattle and did a 2-day private training with it. So it is also an investment. They're not cheap. So I think you're going to see more and more of it. And the cool thing is that the devices are going to get better. The price will come down. The images are going to get clearer. It's exciting. I think it's exciting.
Yeah. Oh, absolutely.
I have to make a comment here because just the fact that we're using technology to visualize the skin is a big plus. I'm sure there's going to be a lot of people that will embrace it, and there are a lot of people that will push back and say it's not necessary. But it would be really interesting to do a study, honestly, like Hadar and Allie, of just looking at people that have had previous filler and to see how long it persists for just by ultrasound. Because what you're
And we
saying
know
is
it's
dead
years and
on.
years. It is.
Yeah,
And
it's dead on. We say that things will break down, but not necessarily. Each person has different biology. Where you place it makes it differentially accessible.
yes.
So I think all of these things make a huge difference.
Yeah, and I think this holistic assessment with ultrasound of where the filler is, where the risk arteries may be, all this kind of falls into place in use of ultrasound. I'll just say briefly that, first of all, a shout out to Jimena Wartzman. She's a radiologist who's doing dermatoradiology in Latin America and kind of brought this to my attention and the world of hidradenitis suppurativa. But I was very surprised recently in one of the conferences to see that conference that was more focused on aesthetics, to see ultrasound. And, actually the price has gone down. I want to make sure that people recognize that when we talk about ultrasound, at least what I mean is a handheld ultrasound. The real innovation is the ability to take the 3 probes and bring them all together into one probe. So you don't have to have this big giant thing. It's a little thing the size of a cell phone maybe, or a little bigger than that. And that connects to your iPhone, to your iPad, to your laptop, wherever you want to plug it in. And the cost varies, but it's just a few thousands per device. So the 2,000, 5,000, 7,000 range, depending on the frequency you want, et cetera.
Right.
And then maybe you have to pay for a couple $100s a year for cloud services. So it's really becoming really accessible. A, it's in your pocket. B, it's a few thousands of dollars investment up front, and that's it, which is not a big deal. It's a lot of money, but it's not a big deal in practice. And so I think the question is, what do we do with this? How are we going to adapt? Because the key point, as you mentioned, is the training. You really want to be involved and really want to be curious about it, because you have to put some downtime to learn. But as you mentioned, it's something that you keep doing and you keep getting good at, like everything in medicine. So anyways, a shout out to all of you ultrasound curious folks out there. Bring it in, start imaging the skin and aesthetics and HS before your surgery, after you inject, 3 years after injection, see what's left there. But really, it's a technology that's going to be really cool.
Ali, can you
forward.
tell Hadar hates ultrasounds? Can you tell that he just absolutely
Listen,
thinks it's just
the
the
thing
fiend?
about it is when you like it, you become obsessed with it. And I get this. I mean, I literally spent 2 days. All we did was ultrasound in Seattle with Dr. Stella. And you get so excited. You're like, oh my gosh, there it is. I see it. I see the infraorbital foramen. Like, there he is.
Yeah, no, it's a game changer. You can do intralesional injections. Now you know where you're putting it exactly. There's many different things. You can look at filogranulomas. You can see
Yes.
different things like that. It's really cool. It's really cool.
And all of this just makes you a better injector. It's not the, magical poof that's
Agreed.
going to make no issue occur. It's not going to fix every issue, but it's about educating yourself for your own practice, for your patient's benefit, for the benefit of dermatology, aesthetics, and for each other. I had somebody reach out last week with an occlusion, and I was able to, offer assistance because we had an ultrasound device. So that whole community environment and just educating. That's another component of educating that I think is fun is people have often asked me, I educate for a company and then I co-own Cult Aesthetics, but are there limitations on who you're trained? I'm like, no, I don't. You can inject next door to me and I'll train you. I think it's our duty as providers to continue to keep that level of, education high.
Yeah, that's definitely another difference between just having a business and being a medical provider, right? We can't think like that and actually think it actually going to hurt you if you kind of keep those expertise to yourself. If you teach someone, you're always going to grow and you're always going to have that edge of experience. So they're always going to come to you. Don't worry. People are going to come to you because you're the expert. I wanted to ask you kind of to wrap this up a little bit. We started with entrepreneurship and I wanted to finish with that because you've clearly been very successful. What are your goals next? What's next for Allie? What peak are you going to conquer?
Oh my gosh, what's next for me? Where I'm at right now with my career in Atlanta is that I have some really amazing patients. I have a great clientele. I'm working on learning how to embrace the other members of my team in a way to get them busy, help them build their own books. So I guess I'm trying to figure out how to educate on entrepreneurship, if that makes sense. I've gotten the education piece down for educating other injectors, but for somebody else that wants to, build their own brand and how to, do what's come in a way natural to me and how to replicate that. I'm excited to continue to build that with my team of injectors. And then for Cult Aesthetics, it's something that I'm really passionate about. We love putting these on. Right now, we've been doing 2 a year. We've talked about doing one internationally. We'll see if that's next in the books. It'll be a really fun experience to be able to take our conference to London. And then as far as our online skincare, I think it all just kind of becomes one big family of things. I think good skin, great injectables, great education, they all seem to live together. So just kind of feeding the babies that I have.
Yeah, no, sounds like you are growing and growing and not going to stop. Actually, sounded a lot like what you were talking about is mentorship, which is really interesting and probably a topic for a whole different episode. But I think when you gain some wisdom and experience in any field, being able to become a mentor to your team, to your peers, is really key because that's a sacred way of how we learn and how we move the knowledge forward and groom the next generation. So that's fantastic. Thank you for sharing that. Yeah. So I think with that, I wanted to make sure before we sign off here, where can people find you online or wherever they're going to look for?
Easiest place to find me is Instagram, the Atlanta Injector. I'm on there far too often.
Easy enough. Easy enough. Well, the Atlanta Injector. Allie, thank you so much for joining us. Thank you for your expertise and becoming a mentor in the field of aesthetics.
Thank you guys for having me. Dr. Hadar, we'll have to get together with our ultrasound soon.
Sounds like a plan.
All right, guys. Thank you.
We'll see how deep that conversation goes. All right. Had to throw the dad joke in. We waited till the end, Hadar, but we managed it.
It came through. Thank you so much for supporting us through the last several seasons. We love receiving your questions on social media. And now, you can call them in as well.
Yeah, exactly. So if you're a licensed medical practitioner, call us at 424-309-8757 and leave a detailed recording with your name, location, clinical question, and it may just be chosen to be answered live on the next podcast.
We look forward to your submissions. And as always, stay curious.